Sometimes it feels like the sun will never rise, like the birds will never sing again. Believe in a power greater than what you are going through. When you don't know what to do, keep breathing.
That's right. When you don't know what to do, just keep on breathing. From the City of Angels in Los Angeles, welcome to all my listeners out there in Radio Land. I'm Dave, the Caregiver's Caregiver at caregiverdave.com, coming to you live and on demand 24/7 on numerous syndicated radio and podcast networks, on 26 global audio and video platforms, including iHeartRadio, iTunes, YouTube, Spreaker, SoundCloud, Vimeo. The list goes on and on. In fact, we are proud to be voted #1 caregiver podcast on FeedSpot out of thousands, and #1 caregiver podcast on Player FM of the top 50. And we have especially exciting show planned for you today. Niki Feret, the owner and operator of Brickhouse Agency and Chicagoland Medicare, a woman-owned independent Medicare insurance agency. Wow. For over 8 years, she's been helping people enroll in Medicare products. She has a passion for educating and guiding retirees, as they navigate the Medicare maze, ensuring each client is enrolled in the right Medicare plan for their health, lifestyle, and budget. Before we get involved in that, I just want to thank my last week's guest, Michelle Menger. She has a passion for connecting with people as we navigate the adventures of aging and caregiving. And just a reminder, you can watch or listen to that interview or all our interviews, including the one we're doing today at caregiverdave.com or any of our other 26 global networks that I mentioned earlier. All right, enough of that. Niki, welcome to the Caregiver Dave Show. It's so excited to have you on.
Yeah, thanks, Dave. It's great to be here.
I always like to ask my guests, first question, just who is Niki Feret and why was she placed on this?
Yeah, well, I am, as you said, a Medicare insurance broker, and I have my own agency. I've been doing this for over 8 years now, and I got started in insurance specifically going to Medicare. I specialize in Medicare. I was a stay-at-home mom for a number of years, and then when I wanted to get back into a career, I decided I kind of wanted some flexibility there, and this is a really great career to kind of re-enter the workforce because you can in the beginning, and you can kind of let it grow with you as you go. So I got my insurance license, focused solely on Medicare, found out very quickly I really enjoyed working with the folks, retirees. Medicare is very complicated, very confusing, and it just feels good to be able to sort of like break it down and simplify it and make sure people, get on a plan that's the best for them. So again, I started about 8 years ago, and then about 4 years ago, decided to branch out and start my agency. We're now in over 30 states, and that's under Brickhouse Agency. And then I also work and do business at Chicagoland Medicare in the Illinois, Indiana, and Wisconsin area. So that's kind of how I got into this industry, and I really enjoy it. Like I said, it's really rewarding working with people and making sure that, as they enter their retirement, they're confident in the health care that they're confident that they're covered with their health care.
Yes, I used to have an insurance license briefly back in the day, but I let it expire because I found it too late. I said, I'm too late to renew it. Anyway, Medicare, how involved do you get with the other plans? The plans that are, what do they call, supplements, right? That will pay what Medicare doesn't pay.
Yeah, exactly. So once you enter Medicare, there are basically 3 options that you can choose between. There's original Medicare, that's Part A and Part B. That comes from the government. Part A helps cover your hospital inpatient care. Part B covers your outpatient care. It is insurance, but it doesn't cover everything. There are deductibles and there is co-insurance involved in that. So people often would like additional coverage as well. So that's what you mentioned, Medicare supplements. So people that want to remain on original Medicare and still actively use those benefits, they can stay on original Medicare and then they can add a Medicare supplement to that. And that Medicare supplement will help pay for those costs that Medicare doesn't. So those deductibles, the co-insurance, like for example, with Part B, this year in 2024, you have to pay your Part B premium, which for most people is $174.70. Then you have a one-time yearly deductible of $240. And then after that, you pay 20% of any outpatient care you receive. That's all under Part B. Your supplement would come in and help cover those costs.
Really?
There are a variety of supplements out there. But the Medicare supplement is a good option for people that want to remain and actively use those original Medicare benefits, because some people like that with a supplement, they can use the network of original Medicare. The other option would be a Medicare Advantage plan. So those are kind of your two major choices once you're on Medicare of the additional coverage that you can choose between.
An HMO in essence, right?
Well, Medicare Advantage plans there's actually a bunch of them. The more popular ones are HMOs or PPOs. HMOs have more rules to follow. You have to stay in network with an HMO. With a PPO, there's still network-driven plans, but you can go out of network. So about people that do something beyond just original Medicare, it's kind of a 50-50 split now. 50% of those people have a supplement. 50% of those people opt for Medicare Advantage plans. So they're just two different ways of getting additional coverage to go along with, or actually in the case of Medicare Advantage, you're kind of replacing original Medicare with a Medicare Advantage plan. So they're just two different ways of getting that health insurance.
So I went on Medicare 5 years ago, and I discovered that not all doctors are happy with accepting Medicare. So how do you navigate that? I mean, even though you have a network, right? Maybe they're just doing it for their own reasons. Maybe they just want to advertise that they take Medicare, but they kind of discourage it. You run into that at all?
Honestly, I don't really have people calling me with that issue. I don't have any of my clients calling me with that issue. Now, there are certain specialties, like, for instance, psychiatrists, less psychiatrists, people who work in that area that specialize in psychiatry. It seems like less of those people accept Medicare. Outside of that, a good number of doctors do accept Medicare. Now, so if you have a supplement, you're going to be able to see any doctor, go to any facility, any hospital in the country that accepts Medicare. Now, and I don't know if that's what you're referring to as well, but like with Medicare Advantage plans, that can be a choice, because Medicare Advantage plans are offered by private insurance companies. So, as an agent, part of my job is to make sure if someone is interested in a Medicare Advantage plan, I ask them, please share your list of doctors with me, and then I look them up to see, because a doctor might take, for instance, and I'm using some of the bigger national names, but some doctor might take a Humana PPO Medicare Advantage plan, but not a United Healthcare, or vice versa. So for that situation, if you're with a Medicare Advantage plan, that's where you need to be more careful with your choice and make sure you either take it upon yourself to look up your doctors, or you work with a trusted agent who will do that for you. And then make sure you keep up with that, and every year you kind of reevaluate your plan and make sure that it's still the best one for you, because seeing doctors that are in network for your plan, that is going to save you money.
Yeah, and well, we'll come back to that. So when and how do we sign up for Medicare?
Okay, so most people are first eligible for Medicare when they turn 65. So you can elect to go ahead and enroll in original Medicare at the age of 65. But nowadays, often people seem to work past the age of 65. In that case, if you have credible health insurance, a good way of, one tip, I always tell people, check with your HR, just confirm with them that what you have is credible medical and prescription drug coverage. But if you have more than 20 employees, if you work for an organization that has more than 20 employees covered under the group insurance plan that you're on, the likelihood is that it will be considered credible by Medicare standards, and you can remain on that plan and continue to use those benefits and not risk any kind of late enrollment penalty. Some people do go ahead and take Part A of original Medicare. Again, like I mentioned earlier, Part A is your inpatient care. Part A for most people, has a $0 premium. You're not paying anything for it monthly. So even if you stay on a credible group plan, you can go ahead and take A and use it as secondary insurance to your plan. But then when you retire, that's when you would go ahead and pick up Part B, and you would get a special election period to do that. So most people can join at the age of 65, but if you're working and you have group health insurance that is considered credible, you can delay your enrollment in Medicare if that's your choice.
Yeah.
And if it's less expensive for you. It's always good to kind of price it out. Maybe it's less expensive to go on Medicare, even if you're continuing to work. So I would suggest look into it on your own or meet with an agent and just kind of do some price comparison when you're, 64, 64 and a half, and just make sure, even if you're going to work till you're 68, 69, 70, make sure that you're getting your health insurance for the lowest cost.
Yeah. I remember what I was going to say before. Acupuncturists and chiropractors aren't always quick to take Medicare.
Yeah, you're right. Well, part of that too is that Medicare only covers certain things with that. So with stuff like acupuncture and chiropractor care, it's a little bit different. You have to make sure Medicare covers these things, because if Medicare doesn't cover it, your supplement's not going to cover it, and your Medicare Advantage plan is probably not going to cover it either. So that's the important thing. So there are certain things that Medicare covers with chiropractic care, but it's not the entire gamut of what's offered. So that's where it's important to look that up. If you go to Medicare.gov, there is a lookup tool on there where you can look up things and see, is it covered under Medicare? And that would be, or if you're on a plan, a supplement, or a Medicare Advantage plan, you can always call your carrier or your agent and ask them to look at the evidence and coverage and see what's covered by your plan.
Yeah. Now, I woke up to a shock when I was 65, because in addition to what they normally charge for Medicare, which is like $100 and some odd, right? Or maybe more.
For the premium, or would
premium. When they give you your Social Security, they deduct Medicare, right?
Yes. Part B is $174.70 this year.
Yeah.
Changes every year.
But because they said I make too much money, charging a surcharge, Yeah. And so with the surcharge they were charging me, because I happen to have a very good year that year, it was cheaper for me to keep my old plan, but they wouldn't let me. It's like it's mandatory. What do you do about things like that?
So what you're talking about is IRMA, income-related monthly adjustment amount. People that make over a certain income level do get that. Like you said, it's a surcharge. It's added on to your Part B, as in boy premium, which is original Medicare. It's also added on to your Part D, as in drugs, your prescription drug plan. So if you have had a life-changing event occur, there is a form that you can go to on the Social Security website, and you can ask for them to look at your situation again and see if you can get that get the IRMA surcharge removed. If you have not had a life-changing event, then you're probably going to be with it. The good news is that the Social Security will look every year, and it's actually 2 years back. So they're going to look at your tax returns from 2 years ago. So in 2024, they looked at your tax returns from 2022. And as your situation changes, like you said, if you just happen to have a really great year, and then the next year is a more typical year for you as far as your income goes, then that surcharge will be removed. So It's not like you're stuck with it forever, but that is something I guess people can look at as they retire. If you had a really great year and you don't mind working another year to kind of wait that surcharge, wait that IRMA 2-year look back out, you can. Other than a life-altering event, you're probably not going to get out.
An example of a life-altering event.
Sometimes a divorce, a spouse's death, things of that nature. There's a whole list on Social Security. If you just go there and look, they have all I say all of them. It's not a ton, but there is a short list on there of things that if it happens, that could be.
What if a spouse What if a spouse has a disability? Does that count or no?
I don't remember that one being on there. I don't know off the top of my head all of the different events, but it's pretty easy to find. if people want to kind of look at it and see.
Yeah.
I had it at one time, I don't know, it was on my board at one time, but I don't see it now. But it's pretty easy to find. If you look up IRMA appeal, IRMAA, you can probably find that pretty quickly on socialsecurity.gov, and it'll give you some ideas of whether or not you might qualify.
Now, remind me again, Part A is the doctor's offices?
Actually, Part A is inpatient hospital care, so it covers your hospital visits.
Part
It also
B of the doctor.
Yes, it covers hospitals, skilled nursing, hospice. Part B covers your outpatient care. So anything you get done on an outpatient status, your primary visits, your specialist visits, x-rays, MRIs, any outpatient surgery, any preventative care, any of that you receive is going to fall under Part B of Original Medicare. Part A and Part B, that's Original Medicare. That's that red, white, and blue card that we're all familiar with.
Yeah.
That's what it represents.
So does the Original Medicare cover prescription drugs also?
It does not. So that's one of the things that's not covered by Original Medicare. Original Medicare does not cover your prescription drugs. It does not cover routine dental, vision, and hearing either. So your drug plan, I would always recommend definitely get one. I have talked to people that have not picked up a drug plan when they were first eligible. Their reasoning was, I'm not taking any medications, which it seems perfectly reasonable if you're not taking medications and then you find out you're going to have to pay this premium for a drug plan. I totally understand why some people are like, oh, I don't need that. The problem with that is down the road, most of us at some point need some kind of medication. If you go, once you turn 65, and then once you turn 65, if you ever go a period of 63 days without drug coverage, either group or a Medicare drug plan, Medicare prescription drug plan, you will start incurring a late enrollment penalty. What that means is when you do enroll in a drug plan down the road, if you do, you will have an extra amount applied to your premium. And that will follow you for the rest of your days. You're not going to get out of that late enrollment penalty. Mm-hmm. So what I tell people is, even if you're not taking any medications, let's just get you on the least expensive prescription drug plan in your area so you have that coverage. And then you won't be in that situation where, 10 years down the road, now you need a drug plan and you have this large late enrollment penalty that you have to pay for on top of a premium for a drug plan.
How large is large?
It depends. So basically, the way they calculate it, it is 1% of the median drug plan of the country times however many months you did not have coverage. So if you just go a couple months, probably not going to be that much. If you go 10 years, it can get significant.
What does it mean when Biden says, I was responsible for reducing the cost of Medicare drugs on insulin from $400 down to $30? What does that mean? Because you said it's not covered anyway, Medicare.
Well, Part D is part of the Medicare umbrella. It's not part of Original Medicare. So Original Medicare is Part A and Part B. And then also as part of, the Medicare umbrella, let's call it, you have Part C, which is Medicare Advantage Plan, and there's Part D, which is your prescription drug plan. So even though the government does not provide... I'm sorry?
You have to pay extra for the Part D drug plan, right?
Yeah. There's a separate premium for Part D. Part D and Part C, which is Medicare Advantage plans, are offered by private insurance companies, but they are heavily overseen by the government. For Centers for Medicare and Medicaid Services dictates, how these plans are run. And so the private insurance companies put them out, but they are heavily regulated by the government. And there are definitely rules that the government has to, that the insurance companies have to follow that the government puts out. So what they're talking about, that insulin used to be very expensive. I had clients on it. They would often go into the coverage graph, which is also known as the donut hole, which has gone away now, but we did have it, and people would pay a lot of thousands of dollars. I never had a client who wasn't on insulin that didn't go in the donut hole coverage gap stage. So what happened is when you got that got the cap on the amount for insulin, that did help keep costs down for those folks.
So I know there's a enrollment period, your birthday or something. When do you have to enroll by those deadlines and those dates? And when do you not have to follow those deadlines and dates?
Yeah, so the initial enrollment period, also known, we do a lot of acronyms for Medicare. So initial enrollment period, IEP, that's when someone is first eligible. So like I said earlier, when you're 65, that's the first time you're eligible to go on Medicare. It's a 7-month window, so it's the 3 months before your birthday, it's the month of your birthday, and the 3 months after. So that's when you first have the opportunity to go on original Medicare. At that point, like I said, if you're retiring and you're not going to have any group coverage, that's when you want to go on full Medicare benefits. It's going to start the first day of the month of your birthday. As long as you enroll in it in those 3 months prior, you can get the first day of the month of your birthday. And then if you have credible coverage, if you are continuing working and you confirm that you can stay on that coverage and not be penalized, then you can either enroll in Part A, which there's no premium for most people, and delay your Part B because you have that credible group coverage, or you could enroll in both if you want. But if you're going to have group coverage, enrolling in Part B usually doesn't make sense because now you're paying a premium for Part B and you're doubling up your premium. But for folks that, go ahead and take Part A at the age of 65, delay Part B, they will get a special election period when they retire, where they will be allowed to go on Part B. And that's also the opportunity they'll have to select a supplement, a Medicare supplement, or opt for a Medicare Advantage plan. So you do get additional opportunities if you don't go ahead and do it when you turn 65. You'll get an opportunity down the road.
Yes. We're getting close to the end of the interview. Is there anything that I haven't mentioned yet that you want to bring up?
The only thing that I would say is for people that have Medicare Advantage plan or a prescription drug plan, which kind of covers everyone, right? Medicare Advantage plans typically come with drug plans. So if you have a Medicare Advantage plan, your drug plan is probably built into it. Or if you have a Medicare supplement, you most likely have a standalone drug plan to go with it. The fall is annual election period. So it starts on October 15th and runs through December 7th. It is the opportunity every year for people on a Medicare Advantage plan or a prescription drug plan to look at their plan, review it, and opt to enroll in a new plan if that plan is not the best fit for them for the following year. So I would definitely suggest to anyone who's on Medicare, or if you're taking care of someone who is on Medicare, reach out. This year we're going to see a little, probably more changes than we have in the past because there's a lot of things going on right now. We have inflation, we have the Inflation Reduction Act, we have a lot of things going on right now that's probably going to mean larger than normal, than typical changes, especially within the prescription drug plan area. And like I said, whether you're on a Medicare Advantage plan with a drug plan or a standalone drug plan, you want to look closely this fall. So in September, you're going to get your annual notice of change booklet for your plan. Look at that, review it, make sure that your plan is still the best fit for you. Look at any new drugs that you've received, see how much they're going to cost you for 2025. And if you need a new plan, that's the time to get it. You don't want to get stuck in a plan all of 2025 that's going to cost you more than you need to pay. So I would recommend everyone do it themselves. Go to Medicare.gov, look up their medications for the plan they're on, or reach out to an agent and have them do that for you and do a review every fall.
That's easier said than done because I've been with United Healthcare for a long time. Mm-hmm. And every year, they seem to raise the rates and it's like it's the devil I know versus the devil I don't know. Do I want to change? I might hate the other plan more. I just stick with it because it's comfortable, and I guess I have no complaints over the previous year. But is that really the right logic to take when choosing a plan?
Yeah, well, if you're talking a supplement, Supplements are different. So if you're talking your Medicare supplement, a lot of people do just stay with those. Now the rates do increase. You can shop those, but it gets a little more complicated because Medicare supplements.
Are they really all competitive with each other because they know what they're doing, right?
They are, but also they are going to increase in price yearly. This year we had larger than normal increases pretty much across the board with Medicare supplements. You saw 10, 12% premium increases. We don't see that every year. This year was kind of different. Medicare supplements, if you do not have what is called a guaranteed issue situation, you will have to go through medical underwriting. So you can always shop your Medicare supplement, but you're most likely going to have to answer health questions and go through health underwriting. Now, standalone drug plans and Medicare Advantage plans are different. Those, if you have a valid election period, you cannot be turned down, and you don't have to answer health questions for those. That's what is affected by the AEP, October 15th through December 7th in the fall. It's not Medicare supplements, but it is Medicare Advantage plans and prescription drugs. Now that I would say, please review it and check it, because if you're on lower cost medications, just kind of like generic maintenance medications, you're probably fine, and you're probably not going to end up paying more. Those medications typically are the less expensive medications. You might even have a $0 copay for those medications. But if you have more than that, more than just generic, maintenance medications, I would say definitely hop on Medicare.gov or talk to an agent, put in your medications and make sure, because it's a very easy thing to switch. It's just filling out a short form. If you work with an agent, they'll do it for you. And it's not a big deal to switch your drug plan or your Medicare Advantage plan. You just want to make sure you do your homework and look things up.
Yeah, I had prostate surgery, and everything was fine, and I have some generic drugs. The doctor gave me these samples of this thing that will take away the sense of urgency. And after I tried to refill it, they wanted like $360 for 30 pills. I says, forget it, So that seems to be, is that because it's a new drug and there's no generic counterpart for it? And is that
most likely
coming out with new drugs so they can charge more?
Yeah, most likely that's a higher tiered medication, a specialty medication, and those do typically have larger copays.
Even filed an appeal, and they denied it.
Yeah, and yeah, you're going to see medications like that. But so each drug plan has its own formulary. So you could look in and see maybe on one drug plan it's at a higher tier on their formulary, which means higher cost. If you move to a different plan, that medication might be on a lower tier, which equals lower cost. So that's where you kind of look around and see.
Yeah. Medications
are not going to be, I work with people sometimes and they'll be like, oh, my medications are very inexpensive. You don't even need to look them up. And I'm like, well, we do need to look them up, because just because it's not expensive on your current plan doesn't mean that it might. Each plan has its own drug list. Yeah. Each plan breaks that drug list up into different tiers and charges a different amount. So it's very individualized. You've got to look them up, and you've got to make sure. It can even cost you different depending upon the pharmacy you go to.
Yeah, and I go to Walgreens, and sometimes the Walgreens' own discount plan that you sign up for is cheaper than what Medicare is going to, charge me. So you got to, it's complicated.
Yeah, it's very complicated. And you can do that. You can utilize something like that, or GoodRx or something like that. If you do it that way and you're paying out of your pocket, it kind of works differently with the drug plan too. So you just kind of have to see which way is the best for you.
Well, I can't believe how fast this time has gone. Thanks so much for coming on the show. How can listeners reach you to get their questions answered?
Yeah, so I have two websites. I have Chicagolandmedicare.com, again, for people who live in Illinois, Indiana, and Wisconsin. I have BrickhouseAgency.com for people in the other states that I service. If you hop on those websites, it's very easy to schedule an appointment. We make it just a couple clicks that you have to go through. There's also a lot of good information, especially on Chicagolandmedicare.com. I have a lot of just good information on there that can be helpful for folks. So I would love it if people would check out the website. And then if they want to schedule an appointment, it's, like I said, very easy. to schedule an online Zoom or phone appointment, and we can meet, and I'm happy to answer any questions.
Very good. Thanks for coming on the show. And again, a reminder, all our live shows become recorded pod and video casts on all of the platforms mentioned. We are at caregiverdave.com. It's a free membership for community with lots of free gifts and resources. And my Facebook page, 34,000 followers, Caregiver Dave. And if you please click the like or follow button, whatever platform you're watching it or listening to this on, it helps us reach even more caregivers by improving Google's algorithms. So again, to all my listeners, thank you again for tuning in each and every week. So until next week, same time, same channel. May God richly bless you. Bye-bye. Thank you, Niki.
I'm Dave Nasani. My fourth book, Secrets from the Hammock, Uncommon Wisdom for Uncommon Times, is a #1 bestseller on Amazon. As a young boy, I was told that I possessed an unusual amount of wisdom for my age. As a teenager, I found myself counseling friends and family whenever they needed answers to their problems. Then at 21, I read the Bible for the very first time and learned how King Solomon asked God for wisdom instead of riches, yet he received both. I was so impressed that I too asked God for wisdom. Soon after, I discovered when lying on my hammock, I would receive wisdom from God. This book is a result of my passion to share with the world wisdom's tremendous benefits. Join me as I reveal practical aspects of wisdom for the mind, body, and spirit. 31 lessons I learned from God that can change your life. Available in Kindle, Audible, paperback, and hardcover, wherever books are sold. I've spoken all over the country and London, and am available to speak at your event. Contact me at hammockwisdom.com.
Sometimes it feels like the sun will never rise, like the birds will never sing again.